Welcome, everyone. My name is Dr. Patricia Murphy. I am the Ecclesiastical Endorser, National Coordinator for Chaplaincy, Pastoral Counseling, Specialized Ministries, and for the American Baptist National Network at American Baptist Home Mission Societies. I'm joined today by Dr. Naomi Paget. Dr. Paget is an FBI chaplain and crisis interventionist. She is a certified crisis chaplain, instructor, and curriculum writer. Dr. Paget is the co-author of the Judson Press book, The Work of the Chaplain. Dr. Paget has recently released a free downloadable resource entitled Ministry During Pandemic, From Awareness to Implementation. This book offers insight on how to increase your awareness, how to make preparations, and implement strategies for ministry, even and while under stay-at-home mandates and self-quarantines. Today, I invited Dr. Paget to discuss some of the current issues we are facing during this COVID-19 pandemic. Dr. Paget, it's so good to see you today, and I thank you so much for taking time out of your busy day to be with me for this conversation. I wanted to just ask you if you wouldn't mind just sharing with us from your ministry context.
Thank you. I'm so glad to be here with you and honored that you even asked me to talk a little bit about this resource. I'm a full-time missionary assigned to the context of disaster and crisis. So unlike many ministers and missionaries, I'm not assigned to a church or an organization, but to a context called disaster and crisis. My clinical practice is within the FBI. My ecclesiastical practice is with the Southern Baptist Disaster Relief Organization, and my social practice has been with the American Red Cross for the past 54 years. So to answer your question more specifically, my current ministry context is within the COVID-19 pandemic.
Thank you. And it is for certain that you bring such a wealth and varied background into helping us navigate throughout this pandemic. As I was reading your book the other day, I came across on page 36 where you talked about a pandemic plan. And you said that when you have a pandemic or when we find ourselves in a pandemic, there are 4 detailed phases within this pandemic or pandemic planning. Would you please open that up and talk to us a little bit about that?
Sure. In 1979, FEMA was established. And when FEMA was established, one of the things that became very, very important was to have a systematic and strategic way to plan how to respond to disasters and all kinds of things that emergency management would be involved in. So the all hazards approach of FEMA was to include things like natural disasters, acts of terrorism, war, and now even pandemic. So the plan was to be more responsive to major emergencies, and certainly COVID-19 is one of those major emergencies. So the 4 pieces of the plan, as FEMA described it, first, the prevention part. FEMA calls it mitigation. Many organizations think more about mitigation than prevention, but it is about prevention. And it includes all the activity that we might be engaged in to prevent an emergency. In other words, reducing the chance of the emergency or the effect of the emergency before it becomes a major emergency. So prevention and mitigation help lessen the impact of the critical event. Now, obviously, prevention and mitigation have to happen before the crisis hits, and it has to continue throughout the crisis to avoid a serious or more serious impact. Now, during February of this year, before any of this was even declared a pandemic, you know that some people hearing about what was happening in China already began rethinking their vacation plans to see the Great Wall of China. They began thinking about alternate vacation plans, alternate destinations. They didn't want to be exposed to the possibility of a virus that could make them very sick. You see, that was a beginning of prevention. They were preventing the possibility that they would get sick. Now, on another hand, you know that other people began to do reading and research, listening to the news so that they could be better informed about what was really happening. And they were preparing themselves and preventing the possibility of getting sick. So this idea of pandemic is not new. At least in my lifetime, I have now experienced 4 pandemics. The Asian flu in 1957-58, the Hong Kong flu 10 years later in 1968, the H1N1, where at least most of this audience would be aware of in 2009, 10, and then now COVID-19. So about the time H1N1 was really getting off the ground, mitigation and prevention was beginning to happen, mostly in healthcare, because healthcare realized that they didn't really have a good plan and policy in place to provide care without having to make on-the-spot decisions about who they would treat, how they would treat them, or what the rules were going to be. So prevention began to be much more intentional by the time we got to H1N1. Now, during this pandemic, prevention has been about washing hands, wearing masks, physical distancing, also about closing schools and churches and restaurants, social gatherings, concerts, even professional sports. But unfortunately, prevention has also meant significant restrictions on surgical waiting rooms, discretionary services like even getting a cavity filled, dealing with allergies, but painfully, restrictions on who could attend funerals or wakes or burials. So prevention is happening, and it's even happening now. But prevention was not always something people thought about intentionally. That's only the first step. Then came preparedness. And preparedness is exactly that. It's about planning and preparing to save lives and to help respond during the time when all of the rescue needs to be done. And obviously, learning about warning signs and risk factors, those become intentional, important parts of this preparedness. So preparedness is very time consuming. Just think about people who have to get ready for hurricanes, getting everything put away, getting the windows closed up, moving your furniture, getting food. All of that takes a lot of time. So if you could imagine that preparedness for pandemic was about the fact that, number one, people didn't know a lot about how to prepare, but number two, they began to prepare almost after it was too late to even prepare. So during pandemic, it was about anticipating and securing supplies that you might need, like cleansers and bacterial soap and diapers and medicine and face masks, and even that extra supply of food and water. So filling the gas tank, household oil in the cold country, getting your insurance documents out of the bank before the bank closed the doors. See, all of those things were about preparedness. So in the book, I listed a long list of preparedness things for families and churches. Even when we know we ought to prepare, there were an awful lot of people who thought, well, this can't impact us that badly. We're prepared. We have extra food. We have extra water. But people didn't really prepare to the depth and level and the breadth that they really needed to prepare. So what about the fact that people didn't prepare and think about, do I and how will I pay my employees if my business gets closed? Churches didn't prepare about how they were going to close their doors or how they were going to continue doing worship and ministry and pastoral care. They weren't preparing for it until they got to that third step response. Prevention and preparedness is critical, and that has to be done before the emergency happens. So in the middle of the third step, response, now people are trying to do prevention and preparedness and response at the same time. And responding says that when the crisis is going on, we have to save property, we have to save businesses, we have to protect people from more harm. Disaster relief organizations train and prepare for exactly that piece of it. They're ready for the response part because they've already done the prevention and the planning part. So they even get together to cooperate and to coordinate through an organization called the National Volunteer Organizations Active in Disasters. When they get together, what they're trying to do is make sure that no one overlooks essential needs that are out there. And they also want to make sure that they're not duplicating efforts, wasting time and resources. So the response phase is really all about the things that happen from the moment of impending warning all the way to the actual strike of whatever that disaster is. So for us, the warning and the strike was almost happening simultaneously for pandemic, because you remember, by the time anybody was really thinking about this in March, we were already beginning to do the restricted closeness for people. So when the Diamond Princess cruise ship was quarantined in February, that was a dramatic prevention effort, but it was also a response because people were already sick and nothing like that had ever been done before. By the time community transmission began in California and New York, the CDC even changed their response tactic to say, everyone now who is exposed ought to be tested, not only those who were directly exposed. That was a significant response. And then by late March, entire countries were being locked down. The 2020 Olympics were canceled. We're still in this response phase.
Yeah.
As a nation and as a world, the disease is still spreading and we're still caring for very sick people, and there's no vaccine for this virus. Unfortunately, we're going to be in the response phase until the last person is healed or the last person is buried. What we're really looking forward to is recovery. And I think that's a piece of what the United States and the world is trying to engage in little by little right now. When the emergency is over, the fourth phase, recovery, says that we actually begin the process of recovery. We're not threatened by the danger and we're feeling safe again. And in most disasters, recovery looks like rebuilding homes and businesses. It looks like community redevelopment and reconstitution, construction. Almost all action in recovery is geared towards trying to return to normal, and a safer normal would be very, very welcome. So recovery means financial assistance to help rebuild, social activity to help people find peace in this new normal. But things are not going to be the same. Things will be different. And for the most part, physical things do improve. The most difficult part of the recovery will be the emotional recovery that seems so elusive for so many people. There are many, many stress-related illnesses and anxiety and grief and depression that could impact many people. who don't have the emotional resources to be what the world likes to call resilient. You have to remember, resilient means bounce back to where you were before. And that's what people are hoping for. We have to remember that there are many secondary losses that people are experiencing too. Not only did I lose my home, but the insurance says that it's not covered. What about, not only did I lose my business, but the government says I can't rebuild because that land is now unstable. So even in this pandemic, there will be secondary losses. Recovery is challenging. And we have to remember that recovery is more like a marathon. It's not a sprint. I believe that recovery after this pandemic will be very much like that marathon. It'll take months or years for our economy to recover. It'll take months before people can take vacations and travel and even go back home because it's out of financial reach. It may take months for businesses to recover from the financial losses that they have experienced. And those small businesses will suffer from the stagnation of being closed for so long. So remember, every pandemic in history has ended at some time. This one will too. So what we know about those phases is that those phases are challenging at every step. But people have to understand that there are things that we must intentionally be engaged in as we go through each one of those steps. We have to stay hopeful and energetic even when it gets tiring to stay home day after day. We have to stay hopeful and still follow the prevention and the preparedness plans that we had. Otherwise, what we're going to do is we're going to start the cycle all over again. We have to get rid of the virus. Until we get rid of the virus, we're really not safe. So FEMA had a good idea when they said we need to consider these 4 areas. And those are the 4 areas that I think that we, as churches and as people of faith, need to be engaged in too.
And thank you so much for explaining all of those phases. And as I was listening to you, the interesting thing about this pandemic is we came in the pandemic, it seems like, on the response stage. We didn't have time to prepare. We didn't have time to prevent. We found ourselves, as you mentioned, right in the heat of responding, preparing, and preventing all at one time. And now, as you see in the news, what is happening today, it seems as if the people have grown weary and now they're pushing us into recovery. And based on what you just described, are we really near recovery? Are we at the recovery phase of this pandemic yet, in your experience and in your expertise? And if you don't believe we're in recovery, what tips or what kind of wisdom can you give to pastors and spiritual caregivers who are trying to get the people to understand the importance of beholding where we are right now in the middle of this pandemic?
Well, I do think that we are definitely in this response period still. I believe that people are trying to engage in recovery because they're tired of being in response. But we can't quit responding. We can't quit preventing, and we can't quit planning. So if we're going to move into recovery, we're going to have to do it very slowly and very cautiously. I know that some churches have decided to open up, and they have decided that they are going to maintain social distancing. They are going to still wear masks. They're going to still try to be careful about washing hands. Some of them have decided they're not opening childcare and children's programs, because it's almost impossible to maintain social distancing with children who don't fully understand what that means in terms of their safety. So what will recovery look like then? I think for most churches, the best advice that we could give them right now is consider your congregation and consider whether or not they are really ready for recovery. Congregations that are made up of many seniors, people who are, and I hate to say a senior is 60, but if you're 60 or older, you know that the CDC and healthcare has said you're vulnerable. So if your congregation has people that are 60 and over, we need to be careful that we continue to protect them as we meet, as we gather. So how bad will it be if we continue doing online services? How bad would it be if we continue doing online Bible studies and meetings? Many people have said that there have been actually more participants because it has been online than it was when it was actually live and in person. So is it impossible? No, I don't think it's impossible. And my personal urging would be try to maintain the response as long as you can, and whatever you do to move towards recovery, do it slowly, do it carefully, be judicious in your decisions about how people will gather and what services you will actually provide in person. If we don't take care of this virus in the sense of reducing its power on us, we will cycle in to a March all over again, and we will see the spread of this virus quickly go from person to person. We already know that it does, so we should learn everything that we know from March and apply it right now so that we don't go back to being where we were in March of this year. So I hope that helps a little bit. I wish there were perfect answers for all of these things. Right. But you know, if you ask 10 people, you're going to get 15 opinions.
Exactly. And I do appreciate all the information that you're sharing with us, even with Dr. Fauci, who is warning us not to go into recovery too quickly. I had said to some colleagues in a meeting yesterday, it appears that when finances, fear, and faith, and I always hate to use fear and faith in the same sentence, but this is what it seems that people have tension between those three things. We need the economy to be rolling. People are without income. People are without economic resources to make it day in. So because they don't have the financial stability that they need, they are, of course, fearful, and rightfully so. And then the faith says we ought to believe that God is going to provide and believe that better days are coming. But when those three things are bumping against each other, this is what we're seeing. Wisconsin opened up their doors and we see people gathering in bars.
Yes.
Help us with this, Dr. Paget. What are some of the ethical and legal ramifications behind forcing recovery too quickly?
Sure. The legal things are things that you and I will not have a lot to deal with. After all, legal means that the law tells us what we must do. I think the difficult part will be for those who have to enforce the law. For example, police officers who have to arrest people because they're not following the government mandate that says they can't gather or that they can't do whatever it is that they're doing. That piece will be difficult, but the law does tell us what is the law. So you and I, as civilian population, really don't have much that we can say about that. I think the part that will be difficult for us are those ethical things that we have to deal with, because ethics are really determined by our profession and by society as a whole. So I think ethically, we're going to have to deal with things that decisions that we made that there was no law or policy or rule behind. Who we served, who we didn't serve, how many we served at any one time. Is my business a big business or a small business? And social distancing, physical distancing, is 6 feet enough, or is 5 feet 6 inches going to be adequate? And do I have to do that in every store or in some stores? You see, those are the things that are going to be harder for us to deal with. I think transparency is also an ethical issue that churches and we will have to deal with. How much do we really communicate about what our financial status really is? How much do we really communicate about how someone's emotional stability is? Is there a privacy issue there? Is that confidential? And what do we ask people to pray for? And how do we ask people to pray for other people? It might be confidential. Is it ethically right to even mention those things? So I think commitments that we have made as a church, as people, our monthly donations to all these very important places that we send money. Are we going to keep doing that? Are we ethically responsible to do that? So I think that commitments to social justice and things like that are important ethical things that we have to deal with.
And I was also considering the ethical ramifications behind or for the pastor who may not know whether or not their parishioner is coming to the church, to the worship service with COVID, that they rather risk and come to the place of worship, and maybe because of some theological belief systems that they may even have about God and healing. So what are some of the ethical legal ramifications that's the burden of the pastor who is opening up the doors in good faith that the people that are coming are not carriers of COVID?
I think it's very difficult if the rules are too general. For example, to say to the congregation, oh, we're going to meet on Sunday, but we're going to ask you to wear masks and practice social distancing. Please come if you're well, but if you're feeling sick, don't come. All right, that's too general. You need to be specific to say, oh, we are going to be sitting 3 seats apart from each other. There will be no exceptions. If you have been outside of your home in a social context where people were not wearing masks, do not come to the service. Please stay home and watch online. You see, those are the things that pastors need to say. They need to be specific. When you're too general, people can interpret it in too many ways. We must be specific, and pastors need to be strong about that. They are spiritual leaders of the congregation, but as spiritual leaders, they also need to watch out for the physical well-being. Just like the shepherd watches out for every physical problem that a sheep might have, the pastor needs to do that too.
Yes, and they also need to remind the congregation that if someone in their home has COVID, that they might need to stay home as well.
Absolutely.
Yes, so I do agree with you on being very specific about what are the terms and conditions for worship. So thank you for that. So I just want to shift this a little bit and just, I remember when you were talking about recovery stages and talking about the secondary losses. So right now we have people who are experiencing great levels of grief. Right. In your book, you talk about the disenfranchised of grief, and then you talked about traumatic grief. Can you help shed some light to help pastors and spiritual care leaders understand what exactly that looks like for those that they're trying to support, or those that they're supporting?
Sure. Grief is a reaction that we have to any perceived loss. You don't have to have actually physically have lost it to feel grief. I believe that people during this pandemic time and after this pandemic time will experience grief like they have never experienced before. They may not articulate that it is grief, but they're going to know that they don't feel quite right. It is primarily disenfranchised grief. It's the grief that people have when others don't recognize it as grief. It's the grief that people have when others don't believe that it's important enough to grieve about. So this disenfranchised grief, I believe, will be a lot about the fact that we have lost loved ones, and some people will not think that it is all that important because so many people have lost loved ones. Well, it doesn't matter. If 10,000 people have died, 1,000,000 people have died, if my grandmother died, it's important. So I think we need to be very sensitive to the fact that we don't minimize people's losses, especially the loss of a loved one, simply because so many other people have died too. Every loss is a significant loss for people. I think during this time, those losses, especially of loved ones, got disenfranchised because we didn't get to have the gathering of people for the wake, for the watch, for the viewing, for the funeral, for the celebration of life. We didn't get to gather for lunch afterwards where we told the stories that we could laugh about and cry about and remember. You see, that's what disenfranchised grief is all about. It's about all those pieces that we grieve we didn't get to do. I wonder how many people have died who had already planned their funerals, who had already said to their children, this is what I want you to do when I die. And then when they died, the children weren't able to do those things. Do you think they might have guilt over the fact that they didn't do the one thing Mama asked us to do when she died? I think that feeling of guilt will be another one that people experience, because people will feel guilty that their loved one died alone. They're going to feel guilty that they couldn't have the funeral. They're going to feel guilty that they weren't able to hug Mama before she died. They're going to feel guilty that Daddy died and I never got to tell him that I forgive him for whatever it was. Do you see? Disenfranchised grief, I think, is what people are going to be experiencing. Disenfranchised grief, I think, can become traumatic grief as well. But for the most part, we're not going to be experiencing some of the ordeal and the context of what traumatic grief is about. Most of us already sort of knew that there was a pretty good possibility that our very aged parents and friends could very well die. We were told over and over how vulnerable they are and how vulnerable people in nursing homes are. So I think for many, we already knew some of that. Grief, disenfranchised grief, guilt, and then I think culturally, I think for some people even shame that they didn't do what they believe they were supposed to have done. So what can we do about it? Well, we're going to have to take time to listen. We're going to have to listen to every person's story as though it's the most important story we've ever heard. And we're going to have to take time to share our stories too, and find somebody who hears our story with no judgment, with no cliches, and without interruption. They hear our story as though it is the most important story they're hearing too. So a lot of the things that we think in terms of this grief wound, we know that people need to stand by and observe the vitals that people are having from these grief wounds. They may not need a tourniquet, but they certainly do need somebody to monitor those vitals. We have to keep them safe, comfort them, stay with them. Our faithful presence will be more effective than any of the words that we say. Grief is a powerful emotion. It takes powerful care to take care of it.
Thank you for that. And I think a lot of times people want to put a time limit even on the grief process, not realizing, as you just so graciously shared with us, the power and the many dynamics and nuances that go with grief, that we want to hurry and rush grief along. And for a lot, because it makes other people feel comfortable, not to have to sit in the place of really owning that hurt and that pain that grief brings to us. And so I thank you for really unpacking how important it is for us to learn to be reflective and empathetic listeners, and to be able to really hold that sacred place for the other as they are sharing their stories, and then not becoming weary in hearing the same story over and over and over again, you know. And so even when we shift the grief and loss a little bit, can you say something about the other type of losses that people are facing, such as loss of income, loss of relationships, significant celebrations? I'm so excited that former President Barack Obama is doing a graduation for the class of 2020 this weekend. Can you speak a little bit to that?
Sure. I think almost always when people think of grief, we think in terms of people who die, but there are dreams that are also have died. When I think of those intrapsychic losses, those are the ones that you can't grab hold of, that you can't name. Some of them aren't even real. They're hopes and dreams and expectations for the future. I think we're going to have a lot of those. I have a grandson who is graduating this year, and he has lost a lot. There isn't a graduation. There isn't the graduation party. There isn't that senior trip. All those things that our graduates are looking forward to, they're not having the way they expected it. I think that for people who expected that they would get a promotion, a bonus this year, you know what? Those bonuses and promotions probably won't happen because there weren't the sales that were made. The quotas weren't met. Those are going to be things that they will grieve as well. I know that when I listen to and I see the comments made by people who have been kept apart from their loved ones, they are grieving that relational contact that they usually have with their loved ones and their friends. They miss seeing them on the walk. They miss seeing them when they have coffee on Friday morning. Those relational losses are significant losses that people are grieving too. And there's no doubt that financially, people have experienced significant losses. The fact that many people get paid for the work that they do that day, they didn't do the work, they didn't get paid. That's an amazing piece of what's happening right now. There are people who haven't been paid now for 10 weeks, and not very many people in the United States, believe it or not, have enough savings that they could keep going on day by day by day and not get paid. So we know that financially, many people are grieving the loss of their income, the loss of possibilities for savings, the loss of possibilities for the things that they've had to cut because they can't afford them, and they know that they were very, very discretionary. So, is a family vacation discretionary? It doesn't seem discretionary if you've been planning on it for the past 3 years, and now all of a sudden it's taken away from you. So even things that are discretionary sometimes are significant losses for people. So hopes and dreams, some of the biggest losses that we have that nobody grieves with us about. And yet they are significant losses for us.
Wow. Dr. Paget, you have certainly given us so much meat and so much to chew on. I can sit here and talk to you for the rest of the afternoon, but time is drawing nigh, and I know that you yourself are very busy helping people throughout this pandemic. So as we close this conversation and hopefully to be able to catch up again at another time, as we're entering into the 10th week of this pandemic, what are some of the things that you would like to say to those who may be able to watch this conversation to give them some hope and some encouragement to hang on? And what are some words that you can share with us?
Sure. I think the first thing that I would tell everybody is keep on keeping on. Stay safe by preventing the spread of COVID-19. Keep washing your hands, keep wearing your mask, keep maintaining a reasonable social distance. Keep on keeping on. And then if you're not good about taking care of yourself physically, emotionally, and spiritually, you need to start doing that now. Do one thing in each one of those categories, and you will do better than you would if you did nothing at all. If you are already taking good care of yourself, keep doing it. And then help other people do it too. Encourage them, help them be accountable to taking better care of themselves. I think everybody has some habits of the heart that can sustain them through really difficult times. Be intentional and make them true habits and not just a list of good things that you might get to someday. I've been working on this habits of the heart idea, and I know that I have at least 12 habits of the heart that are really what I consider essential for my well-being. Of those 12, I think there are at least 3 that I'd like to mention to all of you because I think that they could be very helpful right now. One of those is to have a positive attitude. Don't just keep looking at the news and hearing the negative things. Look at the positive things that are happening in your life because this has happened. The fact that you have learned how to use technology that you didn't even know existed, that's an amazing thing. The fact that people have contacted you who haven't contacted you in a long time, simply because it was easy. They did it by text or email or even on Zoom. Have a positive attitude. It goes a long ways in helping you get through some difficult time. I think another practice of this good heart is to be grateful. I try to think of 3 things that I am absolutely grateful for every single day. If I don't name 3 things that I'm grateful for, all I do is complain about the fact that I don't have something else. But if I can name 3 things that I am grateful for, then I know that I'm also working on that first part about having a positive attitude. I think another very important habit of the heart is to live a life of hope. I am a person of hope, and I believe that I've been able to get through many, many difficult things in my life because I am a person of hope. That hope is not wishful thinking. Wishful thinking really doesn't have an assured result. It's just wishful thinking. When you have hope in God, you have assurance of the end result. So I live a life of hope, and my hope is in God. I need that assurance, and I live because of that assurance. So if those are 3 things that can help other people too, I know that 3 is easy to remember. Have a positive attitude, be grateful, and live in hope.
Amen. Thank you so much. I am encouraged by those words. And as a matter of fact, I'm going to make it my business to get me some habits of the heart. and
Right.
start working on them daily for myself. Thank you so much, Dr. Paget, for your work and for your ministry. I thank God for you. And I pray that as you continue to provide this hope that God gives us across the world, may every single person that you speak to be encouraged and their lives be further blessed because of the work that you have given to us all.
Oh,
Thank you so much. And I look forward to continuously engaging with you.
thank you. Thank you so
Amen.
much.